presentation. Thank you for introduction. So it's a great honor to be here today. Thank you very much for giving me the opportunity to speak at FHS2025. So today I'm going to talk about my research. The title of my research is for extending healthy life expectancy. So I have no degree to I have no COI to declare in this presentation. So first, let me introduce myself. My name is Hiroyuki Takashima, but as you probably know, Japanese names can be difficult to remember, especially foreign countries people. So most of my foreign friends call me just Hiro. Yes, please after me, Hiro. Okay, so I was born and raised in Otaru City. Do you know Otaru City? Otaru City is famous for its fresh food like sushi, and the city is well known for their canal. So let me introduce my work and research experience. I worked at the hospital as a radiologic technologist for about 20 years, Otaru and Sapporo. And I have strongly background in musculoskeletal imaging research for about 15 years in the Department of Orthopedic Surgery at Sapporo Medical University as a research fellow and as a postdoctoral researcher. And to further enhance my research skills in muscle studies, I studied abroad, Division of Cardiovascular Medicine, Stanford University. I worked as a physical science research scientist. And I'm going to talk about my research, especially highlight pressing social issue in Japan. So this slide shows the percentage of the elderly population in my country. So particularly, Japan is facing demographic challenges, declining birth rate and rapidly aging population. So many baby boomers will turn 75 or older, which raises many major concerns for healthcare systems. And the people aged 65 and older make up around 29% of the total population. So these challenges are the result of both a low birth rate and increasingly aging society. So the issue of declining birth rate and aging population has created new challenges. So making it possible to discuss both life expectancy and healthy life expectancy. So as you probably know, life expectancy refers to average number of years a person is expected to live based on current mortality rate. And it's an indicator of the overall health and longevity of a population. And life expectancy doesn't account for quality of life or the number of years lived in good health. In contrast, healthy life expectancy represents the average number of years a person is expected to live in full health, free from disease or disability. And that measure is crucial for evaluating not only how long people live, but also the quality of those years, focusing on how well they live. This slide shows the difference between average life expectancy and healthy life expectancy in Japan. So as you can see, for male, the difference is about 8.8 years. In contrast, for female, it's about 12.4 years. This means that during this period, many people are unable to live independently and require nursing care. And in coming years, elder-to-elder care is becoming increasingly common due to the aging population. It's crucial to focus on extending healthy life expectancy. To extend healthy life expectancy, we need to focus on improving lifestyle-related disorders and preventing illness and severe complications. Addressing challenges such as chronic pain, frailty, and dementia. Therefore, my research is dedicated to contributing the extension of healthy life expectancy. So this slide shows my research project for extending healthy life expectancy in fundamental research for detecting of aging-related disorders using MRI, and mechanism of pain for preventing chronic pain and the development of evaluating microstructure or regenerative therapy. And I'm studying with AI for disease of prediction, automatic examination at the hospital, and was improvement for hospital staff. And one more, I am developing for portable MRI for education, for detection dementia in the countryside, and improving medical access for the development countries. So this slide shows the top 5 symptoms ranked by complaint rate categorized by gender in Japan. According to comprehensive survey of living conditions, so low back pain ranks as the number 1, both male and female. So I'd like to introduce briefly my clinical and animal study related to pain. So previous study have reported the relationship between low back pain and fat generation in paraspinal muscle, particularly increased fat generation. Diagnostic imaging techniques such as US, CT, and MRI have been used to evaluate fat generation in muscle non-invasively. And proton MRS has been used to measure fat content in muscle, or MRS analysis of muscle physiology have applied in various fields, including sports medicine. So this slide shows the example analysis for muscular fat content. We can evaluate intramyocellular lipid IMCL and extramyocellular lipid EMCL. So this slide shows the characteristics of IMCL and EMCL. IMCL appears lipid droplets within muscle cells and associated with aerobic metabolism and accumulation of FFA. In contrast, EMCL is located outside cells and along the muscle fibers and considered to be metabolically inactive lipid. So I used 1.5 Tesla clinical situation. So MRS was performing L4 through 5 interval disc level, targeting on right side, source muscle, and multifidus muscle. So this slide shows the result of comparison of IMCL and EMCL in paraspinal muscle between chronic low back patients and healthy volunteers. As you can see, there are no significant differences. In contrast, similarly, IMCL and EMCL in multifidus muscle, the level of IMCL over chronic low back patients significantly higher than healthy volunteers. So this is my hypothesis. Their relationship, IMCL and chronic pain. So firstly, there are strong correlation between mitochondrial function and IMCL. radius of mitochondrial function leads to sarcopenia and frailty. And then my hypothesis increased FFA and reduced adiponectin will be contribute to inflammation and which in turn chronic pain. So therefore, I'm conducting an animal study to clarify this hypothesis. So I'm investigating the mechanism of chronic pain using mitochondrial mutant mice. As I said earlier, there are correlation between IMCL accumulation and mitochondrial function. And these mice indicate early mitochondrial function, including early aging than wild type. Therefore, my purpose of this study is to explore the relationship among mitochondrial dysfunction, IMCL accumulation, and the mechanism underlying chronic pain. So my research work is performing with 7 Tesla preclinical MRI system and using micro-CT like this image. So my research focus is on developing image analysis methods that can capture aging processes. And with our ultimate goal is contributing to the advancement of non-invasive imaging techniques for evaluating microstructure on degenerative therapy. So next, this slide shows the osteoporotic vertebral fracture with AI. As you can see, as you already know, most osteoporotic vertebral fracture most frequently encountered fractures with a reported prevalence of about 25% in women over the age of 50. And initial treatment is conservative, including rest and external fixation such as corset, which have been shown to produce good outcomes in many cases. So first, there are some issues of treatment over here. Delayed bone union and vertebral body collapse can lead to persistent pain, neurological defects. These complications indicate reduce of ADL and QOL and result in a prognosis. If the risk of non-union and progressive of vertebral body collapse can be predicted at an early stage of treatment, more aggressive therapeutic interventions could be introduced earlier. Therapeutic interventions such as vertebroplasty and surgical treatment. So this slide shows the two cases of prognosis over here. Left side indicates good prognosis. So almost similar vertebral body size. First initial injury and after 3 months later. But on the right side, this image shows poor prognosis. As you can see, this is the first initial injury, and after 3 months, it's very different size, very shrink. So I believe the tool will enable earlier therapeutic intervention and support the maintenance ADL and QOL and prevent all frailty. So finally, I'd like to talk about exploring global strategies for portable MRI. But we don't have time, so briefly introduce. So I have already established magnetic field like this, and already simulated field map, and I have to do next step for my research. Anyway, I want to improve or medical access and improving dementia. So I'd like to summarize my presentation. So the main purpose of my research is to extend healthy life expectancy. And I'm conducting research to clarify the relationship among IUCR, mitochondrial function, and chronic pain. I need to develop a deep learning model for prediction of aging disorder. I'm trying to develop a portable MRI for early detection of dementia, the countryside, and to use in developing countries. So finally, I'd like to introduce my research laboratory, just in case. So my research laboratory named Engineering, Biology, Medicine, Fusion Research Laboratory. Yes, that's it. I'd like to say thank you, my collaborators. Of course, I have a lot of collaborators. Of course, in Hokkaido University, Sapporo Mariam Orthopedic Hospital, Sapporo Medical University, Stanford University, Imperial College of London, Indian Institute of Technology, Muran Institute of Technology, and the University of Cambridge. That's it. Thank you for your attention.
Thank you very much.